Dandy-Walker syndrome is a rare congenital brain malformation that affects the development of the cerebellum, which is the part of the brain responsible for coordinating movement and balance. It also involves abnormalities in the fourth ventricle, which is one of the fluid-filled cavities in the brain. This condition is often identified in infancy or early childhood, though in some cases it may not be diagnosed until later in life. The severity and symptoms of Dandy-Walker syndrome can vary significantly among affected individuals. One of the hallmark features of Dandy-Walker syndrome is an enlarged fourth ventricle, which can lead to increased cerebrospinal fluid pressure, causing hydrocephalus. This buildup of fluid may result in an abnormally large head, a condition known as macrocephaly. Other common symptoms include delayed motor development, poor muscle coordination, and difficulty with voluntary movements. Some children may also experience intellectual disabilities, although cognitive function varies, widely depending on the severity of the brain malformation. The exact cause of Dandy-Walker syndrome is not fully understood, but it is believed to be the result of genetic and environmental factors that affect fetal brain development. Some cases are associated with chromosomal abnormalities, including mutations in specific genes that play a role in brain formation. In some instances, the condition occurs sporadically without any clear genetic link. Exposure to certain environmental factors during pregnancy, such as infections, toxins, or maternal diabetes, may also contribute to the development of the syndrome. Dandy-Walker syndrome is often diagnosed through imaging. Techniques such as ultrasound, MRI, or CT scans, which can reveal characteristic brain abnormalities. In prenatal cases, an ultrasound may detect an enlarged fourth ventricle and other structural changes in the fetal brain. After birth, if an infant exhibits symptoms, such as delayed motor milestones or an abnormally large head, doctors may recommend further imaging studies to confirm the diagnosis. Treatment for Dandy-Walker syndrome is largely symptomatic and depends on the specific challenges faced by each individual. In cases where hydrocephalus is present, surgical intervention may be required to relieve excess cerebrospinal fluid pressure. This is typically done through the placement of a shunt, which helps drain the fluid from the brain to another part of the body, such as the abdomen, where it can be absorbed. Physical therapy, occupational therapy, and speech therapy may also be necessary to support motor and cognitive development. Individuals with Dandy-Walker syndrome may experience a range of complications, including difficulties with coordination and balance, seizures, vision problems, and intellectual disabilities. The long-term outlook varies, with some individuals leading relatively independent lives while others require ongoing medical and developmental support. Early intervention and appropriate therapies can significantly improve outcomes and help affected individuals achieve their full potential. Although there is no cure for Dandy-Walker syndrome, research is ongoing to better understand the condition and develop new treatment approaches. Advances in genetics and neuroimaging have provided valuable insights into the underlying mechanisms of the disorder, offering hope for improved diagnosis and management. Support groups and advocacy organizations play a crucial role in providing resources and connecting affected families with medical professionals and community support. Parents and caregivers of children with Dandy-Walker syndrome often face significant challenges in managing the condition and ensuring their child's well-being. Access to specialized medical care, educational support, and therapy services is essential for optimizing development and quality of life. Raising awareness about the condition can also help promote early diagnosis and intervention, leading to better outcomes for affected individuals. While Dandy-Walker syndrome presents unique challenges, advancements in medical science and supportive care strategies continue to enhance the lives of those living with the condition. With proper medical attention and a supportive environment, individuals with Dandy-Walker syndrome can achieve meaningful progress and lead fulfilling lives.